Hello, my name is Tia Kaufman, and I'm the project director for the Cancer Health Assessments Reaching Many, or CHARM study. Today, I'm going to be demoing the risk assessment tool for you that we have created as part of our study. This will be a two-part video. The second part will be a demonstration of our online consent process and education. If you'd like more information about the study, or if you are potentially interested in using the risk assessment tool, you can contact Katrina Goddard, the principal investigator of the study, at the email listed below. And I'm going to switch over to the risk assessment tool. So before I get started going through the risk assessment tool, I wanted to give a little bit of background on this. This was done in the context of a research study, so we did have constraints that we needed to follow based on the Institutional Review Board, or the IRB. I will mention some of those throughout. So if this will be used in a clinical context, there are certainly changes that you can make if you don't need to follow Institutional Review Board rules. In order to do the risk assessment, for patients to do the risk assessment, they did need to have a full consent, which is what you see here. This can be sent out to patients through a simple web link. It is mobile friendly, so it can be completed on a tablet or even a smartphone, and we had many participants do so, so it works well on those platforms. It is also in both English and Spanish. As you can see up here, there's a button to switch it into Spanish. Those are the only two languages that it currently exists, but there is certainly the possibility of it being conducted in other languages in the future. We've also been asked several times if this tool integrates with the electronic medical record. It does not currently. That would be a great goal for down the line, but as it is now, this is a standalone tool, and the information that patients enter resides on a server at the Center for Health Research. Also, as patients are going through this tool, they cannot go backwards. It is calculating a score based on their answers as they go through the tool. So if they make a mistake or need more information, they can go back and start over, but they cannot just click a back button to go back a single page. We also spent a considerable amount of time as part of our research project making this tool more accessible for a wide variety of patients. So we've lowered the literacy level. We've gotten rid of complicated terms like affected side or first or second degree relative, and we've embedded literacy aids as well. So as I mentioned, we needed a full consent for the risk assessment. It was conducted within two healthcare systems, so I'll go ahead for the sake of this demonstration and pretend I'm a member of Kaiser Permanente Northwest. The tool can both be filled out for yourself, which is it's designed to do, or if someone else is filling it out on their behalf. So if their spouse or a sibling are filling it out, we can collect that information as well. So I'm going to put in a fake patient here and a medical record. For the sake of the study, we defined it as reproductive age, so 18 to 49. Those are not restrictions of the tools themselves, so that can be removed if in your setting you'd like to use it on a more broad age range. I will say the two tools that we use, the BREST for hereditary breast and ovarian cancer risk and the PREM for Lynch syndrome risk, are both tools owned by their developers at both Emory University and Dana-Farber Cancer Institute. So if you're interested in using this tool, you would have to work with them. They're proprietary tools that have a fee, but they are excited to work with people who are interested in using them further. So that's a process you would just need to pursue. So I'm going to pretend that's my birthday. I'm going to say that I am female and that I personally have never had cancer. And here's one of the sections where you can see we put in a definition. And if people wanted a pictorial representation of who their blood relatives are, you can see that here. And I will say, yes, some of my blood relatives have had cancer. If you say no, what this tool will do is pass you to some additional questions to assess your knowledge of your family history. So if you're adopted, or if you don't know about the family history on either your mom's side, your dad's side, or both, or if you have a small family size, those all would allow you to still participate in the study if you had limited family history knowledge. That piece can be removed if an institution is not interested in using that, or you can continue using it. So you will not see those questions because of how I'm going to pass through this now. So I wanted to be sure you were aware of that. Again, it also says here, please don't use your back button. So this randomly assigns you whether you do the PREM or the BREST first. You can see that this is the PREM tool. I'm going to go ahead and say that my mother had cancer, but nobody else did, just for the sake of making this demo short. Again, if you wanted to see a pedigree, you can see that here. And I'm going to say no. But you can see what this does is it walks you through both sides of the family so that you don't have to determine which is the affected side of the family. And I said my mother had had cancer, so I'm going to say yes, she had colon cancer at 35. I'm going to say no to endometrial cancer. And then it also asks about other cancers that are associated with Lynch syndrome. I'm going to say no. And if you can see now, it's switched over to doing the breast cancer assessment. Have any women in your family had breast cancer? I'm going to say no for these questions so that you can see both what a positive and a negative report look like. Again, you can click on this for more information. No to ovarian cancer. Oops. No. You can see it won't let you leave questions blank. And have any men in your family had breast cancer? I'm going to say no. And do you have any Ashkenazi Jewish background? I'm going to say no to that as well. And then you get your results. I will say, as you saw, it will not let you leave questions blank. We have struggled a little bit with people who don't know the information or the answers to the question. So for instance, the age of diagnosis. So we've asked them in this tool, you just have to give your best guess. It will not let you leave questions blank. So this gives you your output for the PREM. Again, this language was heavily driven by institutional review board requirements. For your own institution, you could put whatever language that you wanted in here. This is our strongest worded outcome here. So further evaluation is recommended to carefully review your family history in more detail, to assess cancer and genetic risks, and to consider the benefits and limitations of genetic testing. There's some more information about what genetic testing can do, how to get it. So they could either get it through calling the genetics clinic or through the research study, and then what Lynch syndrome is. And then they get separate output, but it's all in the same screen from the BREST tool. And as I noted, I was putting myself to not be at higher risk. So this says expert guidelines do not recommend hereditary breast and ovarian cancer syndrome genetic testing for you. And then what does this mean? So that we make sure people understand this doesn't mean you have no risk of getting breast cancer. So you have a typical chance of getting cancer and what those are, and then what to do next. And because our fake participant was seen to be at higher risk based on the PREM screening tool, they are now invited to be part of the research study. I will explain more about that consent process and education process in the next video. Thank you for watching, and if you have any questions or if you have any interest in using the tool, we appreciate you reaching out. Thank you.